It started on a Tuesday. Nobody slept the same way again after that. Their Husky had never once acknowledged the baby. Then something changed, and what the parents thought was tenderness was the opposite of that. Koda was a 4-year-old Siberian Husky who had arrived in their household the year before the baby, with the velocity and emotional consequence of a small storm. He chewed things. He talked back. He was dramatic about the rain, about the wind, about the specific brand of kibble that changed twice in 2 years. He was not a calm dog. He was not a dog anyone who met him described as intuitive. That was the part that made it harder to understand when it started. Evan was 6 weeks old. He was a winter baby, born in January, which meant the household ran warm and the windows were sealed and the air had the recycled quality of a sealed space. Felix and Tara were 2 weeks past the fog of early newborn survival and beginning to believe they might locate somewhere in the wreckage the people they had been before. They were not sleeping. They were managing. That is the correct word for the first 8 weeks. Not thriving, managing. Koda had shown no particular interest in the baby. He had sniffed him once at introduction, backed away, and treated him for the subsequent 6 weeks as one more change in a household that had been full of changes. He slept in his crate. He ate his meals. He ignored the crying the way some animals ignore things that are outside their jurisdiction. The first night it changed. Felix woke at 2:08 a.m. to a sound he could not identify and found Koda at the side of the bassinet with his nose pressed against the mesh. This was wrong in 2 ways. Koda's crate was latched from the outside, and Koda had never expressed interest in the bassinet. Felix stood in the doorway for a moment. He said the dog's name. Koda didn't move. His nose was pressed against the mesh directly level with where Evan's face was on the other side. Felix crossed the room and took Koda's collar and looked into the bassinet. Evan was breathing. Fine. Sleeping. Felix put Koda back in his crate and checked the latch and went back to bed. The latch was not sufficient. They discovered this 3 more times in the following week. If you stay for stories about what animals sense before we do, you are in the right place. Subscribe so you do not miss the next one. Tara was a physical therapist. She was not someone who panicked. She was also not someone who dismissed patterns when patterns appeared. And by the 4th night, she was sitting in the rocking chair in the nursery with a notepad, logging the time Koda found a way past his crate, the time he arrived at the bassinet, and what Evan was doing when he arrived. The log ran for 5 nights. On every occasion, Koda arrived within 11 minutes of Evan's breathing slowing below a rate that was, Tara noted, clinically on the lower end of normal for a 6-week-old. Nothing alarming, nothing that would have triggered a monitor, but slower. The slower breath corresponded each time with a deeper sleep state, and each time Koda's presence, the sound of him, the warmth, the scent, caused Evan to shift and lighten and breathe a little faster. She brought the notepad to their pediatrician on Thursday. Has your dog ever done something that made no sense until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard. Dr. Simone Achebe, 6 years in pediatric practice, reviewed the log without speaking for a moment. Then she ordered a pulse oximetry overnight study to be conducted at home. The results showed that Evan was experiencing brief, intermittent oxygen desaturation events during deep sleep. Not apnea, not SIDS category risk, but a breathing irregularity that warranted monitoring and a positional intervention. She had a name for what Koda had been detecting. She called it the arousal threshold response, the same response documented in medical alert dogs trained to monitor infants for breathing irregularities. The difference was that Koda had not been trained for anything except causing moderate domestic chaos for 4 years. She looked at the notepad and said, "He was waking the baby before the desaturation could deepen. That's exactly what a trained respiratory alert dog does." She paused. How did he know to do that? Nobody had an answer for that. Every guardian deserves to be recognized, even the ones who never ask for anything in return. If stories like this matter to you, subscribe so you never miss the next one. Evan spent 2 weeks on a breathing monitor. The irregularities resolved by week 10, which is within the normal window for immature respiratory regulation in newborns. He is now 4 months old and sleeping in graduated stretches and doing every single thing a 4-month-old is supposed to do. He has a fan in his room for white noise, and the bassinet is positioned with a slight incline, and his pediatrician considers him unremarkable, which is the most reassuring word in medicine. Koda sleeps in the hallway outside the nursery now, not in his crate. Felix and Tara made that decision without discussing it. One evening they just didn't latch the crate door, and Koda walked out and lay down in the hallway facing the nursery, and that is where he has been every night since. Felix replaced the crate latch 3 weeks ago. He has not reinstalled it. Some evenings he stands in the nursery door and watches Koda in the hallway with his ears forward and his blue eyes open, and thinks about the 5 nights Tara sat in the rocking chair with a notepad, and the week before that when he kept closing a latch that kept opening, and how close they had come to calling it a crate malfunction and buying a heavier latch and never asking the question that needed to be asked. Coming next on this channel, a story about a dog who wouldn't let a family's toddler near the back fence, and what was living in the gap behind it.